Have you ever suffered with a sudden painful joint? It becomes red and hot and you don't remember banging it. And it's often the big toe. You might discover that in the middle of the night you've got to rip off your bed sheets because you can't even bear the weight of the bed sheets on top of your toe. If so, you might have suffered with gout. So in this video, I'm going to explain what is gout, who gets it, what to do if you get gout, and most importantly, I think, how to prevent it happening again, because I'm sure you'll agree, it's pretty horrible. So what is gout? Gout is caused by an increase in the blood of a protein called uric acid. And this causes little grit-like crystals that gets into that joint, and it's those that cause the pain and suffering that you're dealing with. You might be thinking, well, I think about Henry VIII drinking all his ale and tearing meat off bones, and you might be thinking, well, I don't fit that picture. Well, most of the time, it is actually middle-aged men who do get gout, twice as more likely than women to get gout. But actually, there's also a genetic link in some cases, so sometimes it's much younger people who do get gout. It is often associated with obesity, especially if you're carrying extra weight around your middle. But it's also associated with other health conditions such as stroke, high blood pressure, type 2 diabetes, and heart disease, so they often come together. So if you do get a flare of gout, the best thing to do is try and rest and raise the limb. Pop some ice on it if you can. So wrap that in a tea towel, maybe a bag of peas, keep it on there for about 20 minutes at a time. And if you can take ibuprofen, then take that as soon as you can. That's going to be the most helpful thing. If not, then your GP can prescribe something called colchicine. And if that's not working and you're still struggling, then the GP can prescribe a steroid such as prednisolone. And what can you do to prevent gout? It's actually really important, not only because of how horribly painful and disabling gout is, but it can actually do joint damage if you're getting recurrent gout. So it's really important to focus on what you can do to prevent it happening again. So boring as it is, you need to try and maintain a healthy diet, a healthy weight. There are certain foods that can make you more at risk of getting gout. These are foods high in purine. This is like seafood, too much red meat, and too much alcohol also is a risk factor for gout. So try and have at least a couple of alcohol-free days a week and maybe think about reducing your intake if it's a bit high. Exercise is great. Stop smoking if you can. It's all the usual healthy stuff, but unfortunately this is the stuff that's going to put you at risk of getting gout again. Vitamin C, there's some evidence that vitamin C can help. Staying well hydrated, and it may be that some of your medications need to be fiddled with by the GP if you keep on getting gout, for example some of the high blood pressure medications. And we can also give medication that can help lower that uric acid level that prevents you getting gout again in the future. This is typically called allopurinol. That's the one we most commonly use. And if you've certainly had a couple of episodes of gout in 1 year, then we would really recommend it. But I think with the evidence showing about the damage to the joints, it's a really good idea to consider starting allopurinol even after just 1 or 2 bouts of gout. So speak to your GP if you think that might be for you. I hope you found that really helpful, and watch any of my other videos if you want some other health advice, and thanks for watching. Take care.